Good afternoon, everybody. My name is Paul Cambio. I'm one of the members of the Health and Wellness Committee of the California Lawyers Association. And we're very lucky today to have Dr. Peter Rogers present for us. Dr. Peter Rogers is an MD known for having the best theories for cognitive decline, back pain, and the role of mitochondrial inhibitors in disease. He went to Stanford University. He was the student athlete of the year. He was the captain of the wrestling team. He set a school record for most wins in a season at 39. At med school, he was at the University of Illinois. He graduated first in a class of 333 students with 99% board scores. He did a residency at Northwestern. He had a 99% board score. He had a fellowship at Harvard, imaging guided surgery, a second fellowship, Rush, neurology. He's written over 20 books in textbooks in internal medicine and neurology. Book titles include Medical Reformation, Food, Mood, and IQ, which I have, and How to Improve Blood Flow. His YouTube channel is Peter Rogers, MD, and he's known for simplifying complex topics so that everybody can understand health and nutrition. And without further ado, Dr. Rogers.
Thanks. Okay, let me share my screen then. I'll go into my slides.
Oh, I wanted to add, if you have any questions, please kind of save them for the end because Dr. Rogers might get to them. Put them in the question and answer box, and we'll read them at the end if we have time. Thank you.
Okay, so here is the slideshow. So the first slide, this is going to be, all the patients have the same disease, but you don't have to get it. And the truth is, all the patients pretty much have hypertension and prediabetes or diabetes. Those are the gateway diseases that cause atherosclerosis. Atherosclerosis plugs up arteries in the brain, the heart, the spine, the Johnson, the eyes, everywhere else. And the other thing is the most common cause of death, I call it alexia. Can't read, because almost everybody I talk to always says, I don't have any time to read, I don't have any time to read. And that's nonsense. This is what I invented, the magic bathroom. Just a little table, you push it over with your foot. You can always read something when you're on the loo, number ones, number twos. I got the idea from Mozart. Mozart wrote a letter. He said, I think it only fitting to write while shitting. And then I remember from Monty Python, it said they had a little skit, every sperm is sacred. I said, every void is sacred. I'll always have at least a paperback. If you read just one page every time you go into that room, you'll read at least a book a week. The other thing is it's good to always listen to an audiobook in your car. A good book for starters would be Prevent and Reverse Heart Disease by Caldwell Esselstyn. He's got the best results of anybody in the world for preventing coronary artery disease. Okay, and he's going to recommend a low-fat vegan diet, of course, because that's what works. But that's just a typical example. You can listen to that. You should get through about one book a week in your car. All right, then the next thing is a treadmill. Walking on a treadmill is a great way to read. Okay, you can walk, on your days off for 90 minutes to 2 hours, and you could read a book a week. I routinely read a book a week just doing that. It's very pleasant. I also call it the magic sleep machine. When you've walked, 5, 6, 7 miles, you sleep deeply, just drop like a rock. It reminds you when you were, 20 years old. So everybody has time to do these three things. So don't tell me you don't read. That's a BS excuse. Okay, this is a book I've written, Prevent and Reverse Stroke and Heart Attack. Dr. Esselstyn basically writes for the common man. You'll be able to understand everything he writes. I write at a more advanced level, go into all kinds of detail and nuance. So what Esselstyn says is good enough for the vast majority of people, but I'm going to go into a lot more detail about reasons why I recommend only eat organic and a whole bunch of other nuanced topics, toxicology, filtering water, and things like that. I also wrote the book, Prevent and Reverse Atrial Fibrillation and Congestive Heart Failure, again, where I go into a lot more detail, okay? And you can watch videos on the internet, of course, but I'm just letting you know that's sort of the more advanced material. The disclaimer is, if you change your diet, you have to remember this is a powerful thing to do. Your blood pressure is probably going to drop like a rock. Your blood sugars are going to drop if you're diabetic, for example, because this is going to increase insulin sensitivity. So make sure you do this if you're taking medicines for hypertension, diabetes, or for anticoagulation, that you work with your doctor, because you probably will need to change your dosages. And if you overtreat your high blood pressure, you could be hypotensive and pass out. You overtreat your diabetes, you could become hypoglycemic and pass out. So you need to work with your doctor to titrate things down. Okay, so we're going to be talking about the Holy Grail of health. Okay, here's Jesus Christ with the Holy Grail at the Last Supper. And here's Jesus Christ on the cross. and he has 5 wounds. He's got a wound in each hand. He's got a wound in each foot. And Longinus, the Roman soldier, put a wound in his side. Then the angel caught the blood in the Holy Grail, the same grail, and it's said to have magic healing powers, that anything that touches from it or drinks from it can be healed. Okay? This is a picture called Descent from the Cross, which is quite remarkable, made by Rogier van der Weyden in 1435. And look at the position of Jesus Christo coming down from the cross. And look how Mary's body position echoes him. Can you guess which guild funded this painting? It's the Archers Guild, of course. Okay? And Joseph of Arimathea helped bring the body down. And he also was given possession of the Holy Grail. And he brought it to England, to Glastonbury, near Avalon. Okay, so that's how the Holy Grail got to England, and that's how we're going to talk about it in the context of King Arthur and his knights. Okay, but before we get back to King Arthur and his knights and the Holy Grail, the reason we're talking about the Holy Grail is I'm going to teach you the Holy Grail of healing, what heals the common Western diseases. But first, you should be aware of what the typical chump does. These are the 5 wounds of the village idiot. For somebody to go for open heart surgery, they start out with a cardiac cath from the groin, typically the right groin. You make punctures into the common femoral artery, into the common femoral vein. You pass a catheter up into the heart, do a cardiac cath. Okay? Then the patient goes for open heart surgery. Dr. McDougall, John McDougall, has described the treadmill stress test of a cardiologist's office as a conveyor belt to the stent room or to the operating room. Anyways, for open heart surgery, they're going to take a buzzsaw and cut through the midline of the sternum to then crack the chest to obtain access to the heart for implanting the bypass graft. From the right internal jugular vein, they're going to drop a Swan-Ganz catheter and thread it through the heart, pulmonary capillary wedge pressure. They're going to put a mediastinal drainage tube to drain in case there's any bleeding in the chest. There's always going to be a left pleural effusion. They're going to have a left-sided chest tube as well. And these are the 5 wounds of the village idiot. So why do I call these the 5 wounds of the village idiot? Because open heart surgery, coronary artery bypass graft, typically does not increase longevity. It can reduce the symptoms of cardiac angina, dyspnea on exertion, chest tightness and pain on exertion, but it provides relatively little benefit in the typical situation. And, typically a CABG, coronary artery bypass graft, costs about $200,000. Okay, stents cost about $40,000 a piece. So why go through all that expense and risk all those complications when you can easily prevent coronary artery disease just eating a low-fat vegan diet? I think it's kind of stupid. There's special exceptions when a CABG might be a benefit. Let's say you have an indwelling stent with severe stenosis. You want to bypass distal to it. There's certain things, and valve surgery is a different topic than arterial surgery. But I'm just letting you know, for the garden variety coronary artery disease, which most patients have, why not just cure it with a low-fat vegan diet rather than go through all that expense and risk? So here is the round table of King Arthur. And while the knights were sitting, they had a vision of the Holy Grail. Okay? Painting by Espingues. And they were so excited by it, they all declared they wanted to go on a quest to seek the Holy Grail. And it was agreed upon by the entire group, they shall go on a quest. But only the knight who is valid shall be successful. And this here is Sir Galahad the Pure, Galahad the Pure, the son of Lancelot. Okay? Here are the knights getting ready to depart on their quest to go and seek the Holy Grail. And the reason I'm telling you this is, if you want to be successful, you have to actually follow the diet. And don't go making up your own diet, and don't go contradicting the diet by some nonsense you saw on YouTube. This has been studied for a long time. There's nothing ambiguous about it. You want to minimize your dietary fat as much as possible. There is no such thing as good fats. This is all nonsense. All this stuff about olive oil, omega-3s, canola oil, high-fat foods like nuts, seeds, avocados, that's all nonsense. You want to avoid those things. I'm telling you, that's an important thing, because if you don't do that, you're probably not going to get the results. And that's what I mean by you want to be as pure as Galahad. So Galahad the Pure went off on his quest, and it seemed as if the angels were guiding him. Okay, here's Galahad traveling over the seas with, once again, the angels guiding him. Okay, and so what I say is be like Galahad, is make yourself worthy. Now, let's say you have some self-doubts, because people sometimes have unanswered questions. My advice would be, just try doing the diet for 3 months, Okay, check your baseline body weight, baseline total cholesterol, your blood pressure, whatever else you want to check as a baseline, your hemoglobin A1C or something if you want, your LFTs, liver function test, your kidney function, whatever you want. But most importantly, you got to know your total cholesterol, your body weight, and your blood pressure. That's all you need. All right. And then try the diet for 3 months and see what happens, and really stick with it. Don't go halfway, because if you go halfway, you'll probably get a mediocre result and you won't learn anything from it. The way you learn is by making a big move. But if you're on medicines, work with your doctor to titrate your dosages. Okay. So now we're going to start getting into some of the real questions. So here is the big one to begin with. What is atherosclerosis? And you need to know this. Atherosclerosis is a blood clot. I'm also going to tell you this. 99.9% of your doctors don't know it. Conventional medical doctors in the United States, they are trained in pharmacology. The way they make their money in general, medical school is basically internal medicine school. Match the ill to the pill and send a bill. And then the patients will take these medicines for high blood pressure, for diabetes, for coronary artery disease. They take it every day the rest of their life. They basically milk them like a cow to make money off them every day for the rest of their life, okay? There's no interest in this nutritional diet stuff, because if you cure the patient, you lose a customer. So there's no incentive to teach that. And the reason why you want to know something like atherosclerosis is a blood clot is because it's almost like having a new sense. The concept is that powerful. What I'm getting at is you have eyes to see, you have ears to hear. Well, once you understand that atherosclerosis is a blood clot, now you have a lot of valuable knowledge. Anything that causes the blood to clot is going to increase the risk of atherosclerosis. Okay? That's valuable to know. And there's a lot of tricky little things that cause blood to clot. In general, the general principles are high-fat diets cause the red blood cells to stick together, thus increasing the risk that they will clot. Damage to the intestinal lining lets bacterial toxins, endotoxins leak into the blood, and those cause inflammation that predisposes to clotting, okay? Those are like two of the biggest things. Excess dietary sodium causes the arteries to constrict. It inhibits the vasodilator production, so narrowing of the arteries. It also activates the platelets to be more prone to clotting. These are some of the basic things that predispose to blood clots. So what is a heart attack? A heart attack means you have a blood clot inside the arteries of your heart, the coronary arteries. Coronary means like a crown. So you get an artery occlusion due to clotting, that'll cause a heart attack. Now, can atherosclerosis be reversed? Yes, of course. Why do you think I'm giving this talk? Okay, you not only can prevent it, you can also reverse it to some extent. An atherosclerotic plaque is a combination of old and new clots. The old clots are often calcified, or they're fibrous tissue, scar tissue, collagen, and you're unlikely to reverse that. I realize there's some papers suggesting chronic magnesium supplement or something might reverse calcium. I'm just telling you, I haven't ever seen it in my own personal experience, so I would not put too much stock in that. But what I can tell you is the soft part of the plaque, the acute clot component, the fat in there, the lipid core, the dead cells, the necrotic cells that are being reabsorbed by the immune system, macrophages, that can all be reabsorbed so the clot can shrink. I have seen cardiac caths where the artery opens up. Okay, but more importantly, once you start eating a healthy diet, what we're designed to use, a species-specific diet for humans, the endothelial cells which line the arteries will start to produce more nitric oxide, the vasodilator, and the artery diameter will increase, so you will have more blood flow. That's a very valuable thing, because there's always a lot of little arteries. We don't even know the names of them. We can't even see them, that are supplying all your tissues, and you want everything to be functioning well. Okay. Now, here are the coronary arteries. These sit on top of the heart. Okay, there's really two main coronary arteries. There is the left coronary artery. It starts out with the LM for left main, and that bifurcates into the LCX, left circumflex, and the other branch is the LAD, left anterior descending. An occlusion, severe stenosis in the left main is called a widowmaker, because if that occludes, there's a good chance the patient will die. Okay, the right coronary comes off a different valve cusp. This is the ascending thoracic aorta. And then in the back of the heart, sometimes you'll have a right dominant circulation where the posterior coronary is largely off the right, or it'll come off the left. That'll be a left dominant circulation. Okay, anyways, the reason I'm showing you this picture is there's a guy by the name of William C. Roberts, and he has a YouTube channel just by his name, William C. Roberts. He's the greatest cardiac pathologist who ever lived. And what he did was he did about 2,000 autopsies on people who died of heart attacks. and he chopped their coronary arteries into 5 millimeter segments. And then he looked at the amount of atherosclerotic narrowing in each one. Okay. Now, what I'm about to tell you is an AO, academic orgasm. Okay. So here it is. What he found was coronary artery atherosclerosis was always diffuse. I'm going to say it again, always diffuse. You need to know that, because what that means is it was always diffuse throughout all three coronaries of similar severity. There was not just an isolated focal stenosis in one spot that you could put a stent in and be done with it. It was always diffuse. And again, because it's diffuse, you can't just bypass it and be done with it. No, it's all over the place. And they can't tell at cardiac cath or at CT angiography which plaque is most likely to rupture and subsequently thrombose. So that's why stenting and CABG, coronary artery bypass graft, open heart surgery, don't really do much for increasing longevity of the patient, because it's a diffuse process. The only way you can treat it is with a drug or with diet or both. Okay. And my attitude is, if you can fix the problem with diet, that's nice, because there's no side effects from eating a good diet. No, there's no negative side effects. All right. But you need to know that William Roberts proved that coronary artery disease is always diffuse. That's an important take home point. If you can hit the print screen button on your computer, you want to save that slide, William Roberts. All right. Now, here's another thing William Roberts figured out, that cardiac cath always underestimates disease, because when they measure stenosis, let's say they're looking at this segment here where I've got 25% labeled, they're always comparing to the adjacent segment, which they assumed was normal. But in reality, the adjacent segment was not normal. Okay. So they underestimate the amount of narrowing here. Typically, about 25%, it's narrowed. Okay, so cardiac cath is underestimating disease. People usually have much more atherosclerosis than they realize. Okay. Now, there's a guy by the name of Gregory Sloop. He's a pathologist, and he's the pioneer of something called atherothrombosis theory. And this was actually known back in the 1800s, back in the 1850s. They knew that atherosclerosis was a blood clot. Confusion arose in the 1950s and subsequently on through the 1990s when they made the statin medication. Everybody got so excited about cholesterols, the work of Ancel Keys. And it's true that cholesterol elevation is a major risk factor for coronary artery disease, for atherosclerosis, because it makes blood clot. But they forgot that blood clotting is what atherosclerosis is. In the Bible, it says in Proverbs, fear of God is the beginning of wisdom. And I'm going to tell you, if you want to understand arterial disease and atherosclerosis, understanding the zeta potential is the beginning of wisdom. The zeta potential means that a red blood cell has a negative charge on its outer surface. Okay, you have to know that. And because they have a negative charge, two red blood cells will repel each other. But if you bring into the fold a molecule of big enough size with a positive charge on its outer surface, it'll stick the red blood cells together. So you can imagine if my fist was a red blood cell, and my other fist a red blood cell, and this blue pen here was a bridging molecule, it would stick them together. So what does that? LDL cholesterol. That's why LDL cholesterol is a risk factor for coronary artery disease. Fibrinogen, the clotting protein, will do it. Uric acid, which can be elevated with high-fat diets, with alcohol diets, with high fructose corn syrup. IgM antibodies in the setting of acute infection. And there's a few other things that can do it, but you're going to need to know that concept, okay? The next thing to remember is that a typical red blood cell is about 7 microns. You want to know that, 7 microns in diameter, whereas a capillary diameter is typically only 5 microns in diameter. What that means is the red blood cell has to fold back on itself to pass through the capillary. And because of that, it has to be kind of flexible, all right? Now, the higher the LDL cholesterol in the blood, the higher the blood viscosity, meaning the thicker the blood. Okay, for example, let's ask ourselves, why do you have a blood pressure? Because you need to pump blood against gravity up to your brain, your cerebral cortex, okay? Now, normal blood's like water. But when you have a high LDL cholesterol, because you have high fat diets and the fat sticking the red blood cells together, the blood becomes thick like a milkshake. Now, to pump it up to the top of your brain, you're going to need a higher pressure because you're pumping a milkshake instead of pumping water. And if you superimpose upon that a lot of dietary sodium, like a typical American person who doesn't know any better, they'll eat a pizza. Very high in fat, very high in sodium, the salt. The salt's a vasoconstrictor. It causes the arteries to narrow their diameter. So now you're pumping a milkshake through a constricted, narrowed system. Pressure has to go up. And then the hypertension injures the arteries and causes clots in the arteries. Okay, see how it all goes together and makes sense? I'll continue to, elaborate on the details, but that's the key point. So here's red blood cells stuck together. Now, instead of just pushing, the 7-micron RBC through there, now it's like you're pushing a submarine sandwich through these small arteries and capillaries. So pressure has to go up. Okay, here's an experiment done by Peter Quo. He was a cardiologist in Pennsylvania in the 1950s. He fed his cardiac angina patients a high-fat meal. He just fed them saturated fat. And what he found was the black line here. They'd get peak lipemia at about 5 to 6 hours. He was checking their blood lipid levels every 30 minutes. And at peak lipemia, they would tend to have the most frequent episodes of cardiac chest pain. He's lucky none of them had a heart attack and died on the table. But anyways, and then the fat would slowly clear out from the blood and their angina episodes would become less frequent. Then in the 1960s, they repeated the experiments feeding the patients PUFAs, polyunsaturated fatty acids. That's like omega-6 oils, okay? And what they found was it was even worse. It caused more prolonged sticking together of the red blood cells. Sticking the red blood cells together is called blood sludge. It's also called rouleau formation. Rouleau means stack of coins in French. So when the red blood cells are stuck together, they flow sluggishly through the circulation and they deliver less oxygen to the tissues. Quo had measured a 15 to 20% drop in oxygen delivered to the tissues. Another researcher named Roy Swank got like a 30% drop in oxygen delivery in the brains of hamsters. And there's been numbers in that range by other people who've studied it. Meyer Friedman and Ray Rosenman were two ophthalmologists who did these experiments as well in the 1960s, and they saw a drop in perfusion of the eyeballs because they could look at the eyeball with an 80 times magnification microscope. Bottom line is fat is bad for blood flow. This green line right here is the patient who didn't need any fat, just carbohydrates, and they never had these problems, okay? They never got this lipemia. Okay, now here's also showing blood that the dominant thing in your blood is the red blood cells. Over 99% of the cells in your blood are red blood cells. So if your hematocrit goes way up, like think about those Tour de France bicycle riders who started taking epoetin to raise their hematocrit so they'd have more energy when they're climbing a hill on their bicycle. The problem is that when they're just laying around their apartment, very high hematocrits. Hematocrit means the amount of red blood cells in your blood. Like here would be the hematocrit, the red blood cells if you put it into a test tube. The little white line is the white blood cells. It's also called the Buffy coat. The plasma is translucent. You can normally see through it. All right, so what I'm trying to say, though, is if you artificially elevate the hematocrit through taking a drug like EPO, you'll increase your risk of having a heart attack. Your blood will become thicker and it's predisposed to clotting. You don't want to do that. It's a stupid thing to do. A lot of these otherwise relatively fit young guys died from heart attacks because they artificially elevated their hematocrits with EPO. All right, this is from the movie Game Changers. They took the blood in test tubes after patients ate a high-fat meal. And after they ate a high-fat meal, the plasma would become opaque. You could no longer see through it. Through this, you could, read letters on the other side of the test tube if you put a sticker on it, but you can't see through this. It's just too thick. So it's a physical manifestation right away when you eat a high-fat diet. Now, fat is bad, and fat is what starts causing a lot of problems. Diabetes begins with the accumulation of fat in the skeletal muscle. So after you eat, to eat is prandial. So postprandial means after eating. Normally, glucose from your meal should primarily go into your muscles to be stored as glycogen, okay? But if the fat gets there first, like you start out by eating a high-fat food, then you eat the carbohydrate, the fat overwhelms the skeletal muscle's ability to produce nutrients, energy, to metabolize it, and then it'll block the entry of glucose into the muscle, okay? This has been figured out in great detail. The guy who did the most precise recent work on it was Gerald Shulman. He won the Banting Award in 2018, and he showed that accumulation of fat in skeletal muscle is the #1 earliest detectable finding of insulin resistance in diabetes. Okay, you start then accumulating fat in the liver, getting a fatty liver. I can tell you the vast majority of Americans have a fatty liver, which is like diabetes of the liver. Not good. The liver loses its ability to accurately sense blood glucose level. The most important thing your liver does is sense the blood glucose level and maintain it at a normal level so your brain has glucose. That's the most important thing the liver does. So you don't want a fatty liver. After you have a fatty liver, you'll start accumulating fat in the pancreas. And once you accumulate too much fat in the pancreas, the pancreatic beta cells, which produce the actual insulin, are damaged by it, and then they are destroyed, they die, and then you no longer can make enough insulin. So if you were to have this, there is a time of the essence. The clock is ticking. You want to turn this stuff around and don't BS yourself. The typical stupid patient is like, well, I'm doing okay. I'm doing okay. I have a good doctor. My glucose is under control. And whenever I hear that, I think this person's an idiot, okay? Because I realize they're just ignorant. They don't know any better. Ignorance is curable by reading and learning, but the typical ignorant person, they just do whatever their doctor says. And your doctor probably has not been trained in nutrition or toxicology. They don't know any of this stuff. The level I'm speaking at is beyond what doctors learn in med school, residency, and fellowship, okay? I am their teacher, okay? This is just complications of diabetes. Now, here's to show you what happens with insulin resistance. The excess fat inhibits intermitochondrial membrane electron transport around the level of coenzyme Q and complex 3, okay? And then it'll start to go backwards, okay? The real reason, especially SAT fat, is worst is because it's sending too many electron carriers too rapidly, NADHs. All right, well, anyways, here's the consequences of that. First of all, here's what normal insulin does. You have high blood glucose. It senses that coming up the portal vein from the gut. And the pancreas releases insulin. It travels to the skeletal muscle, binds the skeletal muscle insulin receptor. That sends a signal to the plasma membrane vesicles containing glucose type 4 transporters. The glucose type 4 transporter vesicles diffuse up to the plasma membrane. They merge with it. And then the glucose type 4 transporters allow glucose to come into the cell. That's what normally should happen after you eat a meal. But if you eat a high-fat meal, especially saturated fat in this context early on, it will flood into the cell too rapidly. The skeletal muscle will not be able to control its entry, and it overwhelms the mitochondria. And now the mitochondria sends a signal that it cannot handle any more nutrients, any more food energy. So it will block these glucose transporters. Think of this red line as being a big block. So these glucose type 4 transporters cannot go up to the plasma membrane. And because they cannot merge, the glucose from the blood can't get into the skeletal muscle, so it stays in the blood. That's what causes high blood glucose in diabetes. So the average ignorant person, including a lot of ignorant internet so-called nutrition and health influencers, they think the problem with diabetes is high blood glucose. It is not. The problem is fat. It is the fat which causes insulin resistance. It's like, as Dr. McDougall had said, people should be fat counting, not glucose counting. This is an important point to understand, because if you don't get this right, you'll never know what to do and you'll never get better. Most diabetics never get better. They just progressively deteriorate and they suffer in a miserable way. And, the average person, average American is cognitively slow, fat, sick, and stupid by the time they're 60. It doesn't have to be that way, okay? I'm 63. I'm healthy, okay? I'm doing fine. That's what you want, okay? I got a little eye infection because I got powder from my surgical gloves when I was doing a procedure in my eye, but I'm fine, okay? I don't have hypertension, diabetes, coronary artery disease, okay? I want to avoid those things. Here's what happens for carbohydrate intolerance. The red line is they eat fat first. Then they follow it with glucose, and now they've got insulin resistance from the fat. So their blood glucose level over here spikes real high. Okay, that means that the fat caused carbohydrate intolerance. All right, now if you just eat the carbohydrate, you'll normally get a little bit of spike in your blood glucose level, but then it'll come back down. Starches are the best way to satisfy your hunger. Now here's what I was talking about with regard to dietary fat causing insulin resistance. The fatty acid will merge with the outer leaflet of the plasma membrane surrounding a cell. This is the phospholipid bilayer of the plasma membrane. It'll become protonated. It'll intercalate itself into the outer leaflet of the plasma membrane. And then it can flip into the inner leaflet of the plasma membrane. This is called the flip-flop maneuver, so to speak. And then it will enter the cytoplasm and it will travel to the mitochondria. So what I'm trying to say is this is dependent on the concentration of fat in the blood, which is dependent on how much fat you ate. And this is why you want to eat low-fat diets, because there is no way around this. You can't, take a medicine to inhibit the plasma membrane transport protein. There is no transport protein. It just flip-flops across the membrane. It's like a bulk transport in proportion to the concentration of fat in the blood. So you cannot win this game other than reducing dietary fat. And you need to know that, okay? Because what I'm trying to do is I'm trying to give you the rationale so you'll be able to make intelligent decisions, okay? And don't go thinking you know more than me, because you don't. And when the patients try to think for themselves, they screw things up. What you should do if you have a question is start reading about it. Start reading the papers, reading the books, watching the internet videos. Continue to educate yourself, okay? But I would say when you first start out, just go with what has been proven to work. Test it out on yourself for 3 months. See what happens to your body weight. See what happens to your total cholesterol. See what happens to your blood pressure. See what happens to your blood glucose if you're diabetic. because once you see that it works, then you'll be motivated to stick with it. What the average chump does is they kind of go halfway on everything, and then they get kind of a blah result, and they're like, well, I don't think it makes much of a difference. And you don't want to end up like that, okay? Because there's really only two paths. You're either going to fix yourself by learning what to do, or you're going to be on drugs the rest of your life. And why not just eat the healthy diet, which makes everything else better as well? Now, here's a normal capillary. Here's the red blood cells flowing through. The blue circles are oxygen being delivered to tissue. In this case, a brain cell, a neuron, an axon is the long part of the neuron. Okay, so again, the red cells are about 7 microns in diameter. Capillary is about 5 microns. The yellow is the capillary basement membrane. The green is the vascular smooth muscle cells. And the oxygen has to travel this distance from the capillary to the tissue. Now, when you have diabetes, you get thickening of the capillary basement membrane. You get hypertrophy and proliferation of these vascular smooth muscle cells. All of this can increase the distance that the oxygen has to travel to get to the tissue. And that's going to drop oxygen transfer. You'll also sometimes get fibrous tissue growing in here that further limits the amount of oxygen that can get to the tissue. So that accumulates over time. As people get older, they get more thickening of this capillary basement membrane and smooth muscle hypertrophy and collagen being laid down. So they get decreased oxygen delivery. So you want to be as healthy as you can to minimize this happening. Diabetes and hypertension make this worse. High-fat diets are the main cause of both of them, okay? And sodium makes them both worse as well. Now, here's a great book by a guy named Jack Delatorre. It's called The Alzheimer Turning Point. And what this PhD researcher did is he tied off the carotid artery in a mouse, okay? And then 2 months later, middle-aged and older mice would be demented. He opened up their skull at autopsy, and he looked in and he saw the brain was shrunken in that location, atrophic. And no matter what he did, he tied off both carotids, vertebral arteries in the back, intracranial, middle cerebral artery. He got the same result all the time. So he came up with what he called the vascular hypoperfusion theory. If you drop blood flow to a tissue, it will be damaged by the lack of blood flow, and it'll gradually shrink over time. And at first you say to yourself, well, so what? Not many people have a severe carotid stenosis or occlusion. True. But guess what? Tons of people have hypertension that's overtreated, and they're globally dropping perfusion of their brains. Most common reason old guys fall is because they're overtreating their hypertension. The reason you had a blood pressure in the first place was to get blood to the top of your brain. And why is your pressure so high? Because you're eating a high-fat diet, a high-sodium diet. So instead of just taking a pill, why not fix it by stop eating all that fat, stop eating all that sodium? Wouldn't that be smarter than, having continued high pressure, having to compensate with a drug? Okay. All right, what else? Atrial fibrillation. You lose the atrial filling about a 25%. You drop in perfusion in your brain. Congestive heart failure. Tons of people got CHF and AFib. Okay. Tons of people have overtreated hypertension. The drug companies are always trying to push down the threshold at which to treat hypertension, because the lower they get that threshold, the more people they can put on drugs, millions more, okay, and make more money off them. But you're playing a dangerous game because you want that Goldilocks balance. Pressure's too high, you damage the arteries, cause intracranial atherosclerosis, okay? Pressure's too low, you drop perfusion to the brain, you could pass out, and you could also be losing brain cells by apoptosis, the Delatorre theory. I call them mouse equivalents. So you get it, you're damned if you do, damned if you don't. So why not be intelligent and eat what humans are designed to eat, a low-fat, plant-based diet, okay? Other reasons for underperfusing the brain: aortic stenosis, aortic valve regurgitation, post-CABG hypotension. They run people pretty hypotensive after open heart surgery. My father ended up having this. It was many years ago. It was like 30 years ago. I didn't know enough then. I told him not to have it, to go vegan, but I wasn't able to come down on it strong enough to convince him. And they ran him post-op like 95/60. I said to the anesthesiologist, why are you doing that? And he goes, we don't want him to bleed it as anastomosis, the plug-in sites for the graft. My dad came out of it pretty well, but he's a lot healthier than the average CABG patient. It's you don't want to go for CABG. If you can avoid it, which you can with low-fat vegan diet, I wouldn't get a CABG. All right, so anyways, here's what the brain looks like. And again, the Goldilocks concept. Internal carotid artery comes up into the brain. There's an anterior cerebral artery, which I didn't draw because it'd be too complicated. This is the middle cerebral artery, the MCA. Goes up around the cerebral convexities, and then it drops these penetrating arteries. These are the lenticulostriates coming up from below off the proximal segment, the M1 MCA. Okay. I drew a skull and crossbones right here in the periventricular tissues. This is really called the corona radiata, centrum semiovale up here. But the point of it is that this is a relative end artery zone, poor collateral blood flow. So if you overtreat hypertension, you're not going to fill these penetrating branches so well, okay? And if your hypertension is severely high, uncontrolled severe hypertension, systolics in the 200s, you might have a little stroke in this area, like a lacunar infarction, okay? Anyways, I'll see some patients with 100 little strokes in their brain from this type of problem right here. Okay, and a lot of times these are mild strokes. They don't even manifest as any hemiplegia or anything, but the patient's just cognitively slower and slower and slower. Okay. And that's what I meant by the Goldilocks balance. You don't want pressure too high. You don't want a pressure too low. What's the best way to maintain that pressure? Eat the diet you're supposed to, the species-specific diet, which is a low-fat, plant-based diet. I'm going to show you a little bit about the gut just so you understand it. We don't got time to go into all the detail, but here's the bottom line. Fiber is your friend. Dietary fiber feeds the good bacteria. I made them into smiley faces. They take the fiber, they convert it into short-chain fatty acid, in particular butyrate. Butyrate has 4 carbons. You can think of it as like a butanoic acid, a 4-carbon carboxylic acid. And that 4-carbon fatty acid goes, this is the only type of fat that's good, fiber being converted to butyrate. It's the only one, okay? You need a tiny bit of omega-3s, a tiny bit of omega-6, but it's such a small need, it's impossible to be too low on those if you're eating a plant-based diet of naturally chosen foods. Okay, the butyrate goes into the gut lining cells. They're called enterocytes because the gut's the enteric tract. They're converted into tight junctions, and those keep the bad stuff out, okay? This is what you want. This is exactly how it is supposed to be. And they nurture your gut lining cells. Everything is good. Okay, now this is a whole list of things that damage your gut lining, and there's a lot of things that do it. Most commonly, it'll be a lack of dietary fiber. So now your intestinal lining cells can't make your tight junctions. Plus, there's a lot of things that are toxic to the gut. High-fat diets are toxic to the gut. The herbicides on non-organic food are toxic to the gut. Alcohol is toxic to the gut. Emulsifiers in processed food are toxic to the gut. A lot of food additives in processed food, carrageenan, chemicals as part of non-organic food like BT corn, okay? Dishwasher soap. If you don't fry food, then you don't need dishwasher soap, okay? And there's a whole bunch of other things. Some of these artificial sweeteners are toxic to the gut. Excessive amounts of simple sugar are toxic to the gut. Okay, the fluoride and the aluminum in non-filtered tap water are toxic to the gut. When you have a hole in the gut, that means bad things can get across the gut. It's typically called leaky gut. It means increased intestinal permeability. Now, the bad bacteria, see how I've got them frowning with angry eyes? They make bacterial endotoxins, in particular LPS. That's lipopolysaccharide. That's what gram-negative bacteria make. Gram-positive make LTA, lipoteichoic acid. Just remember, bacterial toxins can get across leaky gut. They come into the blood, and they predispose to clotting. The reason they predispose to clotting is because they change the shape of the blood clotting protein fibrinogen. It changes from being what's called alpha helix in its secondary protein structure, which is like a slinky, to becoming beta-pleated sheet and flatten. And when it's beta-pleated sheet, it'll start to form hydrogen bonds between the other beta-pleated sheets, so the molecular weight will increase. The higher molecular weight is in aqueous solution, the more likely is something is going to precipitate. To precipitate in the blood is to clot. You get it? When you've got leaky gut, you start forming more clots in your blood. If you're iron overloaded from eating too much meat, or you're iron overloaded because you eat processed food fortified with iron, which is a bad idea, but that's what they do, that will cause the same thing. It'll distort the shape of fibrinogen. A distortion in the secondary protein shape, viral infection can do this too. A distortion in the secondary protein structure from alpha helix to beta pleated sheet, that's called an amyloid transition. So this is called amyloid clotting. It'll sometimes in the literature be called fibrinolytic clotting. The English PhD, Douglas Kell, and the South African PhD lady, Etheresia Pretorius, have done the best work on this. Okay, but your doctor won't even know about this stuff. You got to remember, I'm way more advanced than your doctor, okay? There's tons of paper. These are some of the most cited papers in the literature, okay, on hematopathology. But I'm just telling you, that's where it comes from. Okay, and those clots are typically 2 to 200 microns, so they plug up the little arteries in your body. Also, I had read about diabetes due to reversal of electron transport in the inner mitochondria, and I had sort of indirectly come across a few mitochondrial damaging toxins here and there, but I knew there had to be more, and I couldn't find any information about it. I own 7 biochemistry books, so I went through all of them, all my med school, grad school, nutritional books, my toxicology books. I couldn't find any of this stuff. So then I started going through all the literature on mitochondrial inhibitors. I found over 120 of them. Okay. And your first reaction is, oh, well, they're probably rare. I don't think so. Tell me if you ever heard of these drugs. Tylenol, metformin for diabetes, statins for high cholesterol, fluoride in your tap water, aluminum in your tap water, common antibiotics like aminoglycoside, fluoroquinolones, beta-lactams, antidepressant medications like Prozac, fluoxetine, sertraline, and a whole bunch of other ones, antipsychotics like Haldol, okay? All the processed food has antifungals in it, which means anti-mold, preservatives to prevent mold growth. Well, guess what? They tend to inhibit succinate dehydrogenase, which is part of both intermitochondrial membrane electron transport and part of Krebs cycle. They're all bad. Okay, this is why you want your life to be simple. Later on, I'm going to talk about you want to live like Adam and Eve, but keep your indoor heating and plumbing. Avoid all this modern crap. It's not made for humans to the extent you can. Sometimes you can't avoid something. It's a trade-off. But there's a lot of stuff people don't realize. If you eat omega-6 cooking oils, they tend to undergo lipid peroxidation reactions producing something called HNE, hydroxynonenal, which is toxic to your mitochondria. Okay, there's a lot of bad things happen from eating. You never, ever, ever want to eat fried food. Never again the rest of your life eat fried food. It causes brain damage. It's much worse than is widely recognized. These artificial plastics like BPA and the BPA equivalents, they're also mitochondrial toxic. Okay, so a lot of people are routinely exposed to 10, 20 or more of these mitochondrial toxins, and that's decreasing their brain and their heart and other parts of their body, their muscles' ability to produce energy. So they feel tired, they feel weak, and they're also at increased risk to lose brain cells and to become cognitively impaired. Okay, I have the best theory in the world for cognitive decline. It's called the supply and demand theory. We don't have time to get into it, but I'm telling you, inhibiting your mitochondrial function is part of it. Dropping your blood supply, like Jack Delatorre talked about, is also part of it. And then ingesting stimulants like caffeine or the equivalent, being sleep deprived or stressed out for other reasons, they all contribute to losing brain cells. Your coronary arteries, as we spoke about before, they're on the outer surface of the heart, the epicardium. You have a typical left-sided normal bifurcation. Left main, the widowmaker, goes into the circumflex, and the LAD, left anterior descending. But in the ballpark of 20% of people have what is called a ramus intermedius, whereby their left main, instead of having a bifurcation with 2 branches, it has a trifurcation with 3 branches. What that means is that each of these individual branches is smaller than if you just had 2 branches. And the significance is the bigger the artery, the easier it is to stent, the easier it is to bypass. When you've got a trifurcation, it's going to be harder to stent, harder to bypass, and these patients have increased risk of a heart attack. And what I'm saying is, what do you have? You don't know. Unless you've done a cardiac cath or you've done a CT angiogram, you don't know if you got a bifurcation or a trifurcation. So the wise move is to assume that you have the unfavorable anatomy and just live your life as such, as healthy as possible, so that even if you were to have this, in these countries where people eat traditional plant-based diet, low-fat diets, they don't ever get heart attacks, hypertension, or diabetes. Never. Okay. A typical example is look at blacks in America. Okay. Blacks in America have hypertension off the charts. Okay. And medical students are taught, well, it seems to be genetic, maybe salt sensitivity. Nonsense. There's a paper. It's a C.P. Donison paper, Lancet Journal, 1929, blood pressure in the African native. It was obtained in Kenya, 1,800 consecutive black men admitted to the hospital. They checked their blood pressure. What percent were hypertensive? 0. When they ate a plant-based diet, they were 0, none, not a single one hypertensive. The reason blacks have a lot of hypertension in the United States is because they eat a Western diet, which is very high in fat and very high in salt. They eat a lot of processed food. So what I'm saying is, don't ever say something is genetic, because once you say it's genetic, you're surrendering. You're saying, oh, there's nothing I could do. And it's almost never genetic. Hardly any disease is genetic, okay? That just gets talked about a lot. Hardly anything. And then other people say, no, it has to be. I have a positive family history. My father had heart disease. My mother had heart disease. My brothers and sisters all have heart disease. And I would still say BS. The reason why y'all have coronary artery disease is because you all eat the same stupid high-fat diet, okay? It's not your genetics. And I say that because the same populations of people, you take them back in time 100 years ago, they didn't have any coronary artery disease. All this genetic stuff is stupid, okay? It's a way to turn your brain off and stop thinking. Now, here's just a typical epidemiology population. This is in northern Mexico, the Sierra Madre Mountains, Copper Canyon area. Sierra means like a saw. That's what the mountain tops look like. The Tarahumara people there in Mexico, they're famous for being ultra marathoners. They have a holiday where once a year they run like 100 miles in 2 days. Okay. They used to be combined with a population called the Pima. So genetically, they're about the same. In the Mexican-American War of 1848, the Pima were absorbed into Arizona. They now eat a standard American diet, which is high in fat, high in sodium. They got tons of the Western diseases, tons of hypertension, diabetes, coronary artery disease, and all the subsequent complications that follow from that. This is a below knee amputation, open heart surgery, all this other stuff, and they're very sick. You can double check everything I'm saying in 5 seconds. Just type into your computer Pima obesity, and you'll see lots of fat Pima and all their disease. So type in Tarahumara runners, you'll see these ultra marathoner runner guys. And what do they eat? They eat their old fashioned corn diet with local greens and some beans, for example. Okay. And it's the same thing anywhere you go in epidemiology. Look up the Okinawas eating old-fashioned plant-based diets with a lot of, let's say, sweet potatoes, for example. Papua New Guinea, where they're eating 92, 93% of their calories from sweet potatoes. They're skinny and healthy, people eating regular potatoes. Potatoes, white rice, and sweet potatoes all have only 1% of calories from fat. They make you skinny and healthy. Okay, here's the Yanomami, and I think these guys are funny. I'll tell you why. They live in the Amazon jungle on the border between Brazil and Venezuela, and they're kind of violent and crazy. They're constantly fighting with the other Yanomami tribes. And what they do is they try to attack the other tribe and they try to kidnap their women. Okay? So it's a pretty stressful life if somebody's always trying to kidnap your women, or you're knowing that you got to go tomorrow and try to kidnap a woman. So because of that, they have a high stress. But despite having a high stress, they eat a plant-based diet. They don't get hypertension, diabetes, or coronary artery disease. And the relevance of me saying that is diet's more important than psychological stress. Psychological stress is still relevant, but diet's more important, okay? And the other reason why I thought that was funny was because here's these guys, they're a bunch of illiterates. They know more about how to prevent coronary artery disease, obesity, diabetes, and hypertension than all these Ivy League professors that are just, on a committee paid for by a drug company trying to write standardized protocols that everybody has to follow to sell drugs. You get it? None of these so-called Ivy League big shots knows anything about diet. I'm not kidding. The amount of training in medical school and residency on diet is zero. None. All right, now here's blood pressure. You have two numbers. The number on top is called systolic for contraction. Systolic means Greek for contraction. The number on the bottom is diastolic for relaxation of the heart in Greek. Okay, this would be a really high blood pressure, 200 over 100. And a more normal blood pressure would be like 110 over 70. Okay. Now, another thing you want to know about is called the Windkessel effect, or the Windkessel effect. And this is like that accordion-like thing, the puffer. You blow air on a fire to get the kindling to flame up, throw some paper on it or something. So the ascending thoracic aorta has what is called the Windkessel effect. So when the left ventricle contracts, it pushes blood into the ascending thoracic aorta, which then is stretched outward. Then when the heart relaxes, now you're in diastole over here, the elastic fibers in the wall of the ascending thoracic aorta, they have what is called elastic recoil. They recoil inward, and that pushes blood during the diastole phase, okay? And so that keeps the cardiac systolic pressure and diastolic pressure kind of close together, like 110 over 70, all right? With chronic hypertension, you're going to overstretch this ascending thoracic aorta for a couple of decades, and you're going to lose all those elastic fibers. They can't be replaced after 20 years of age. And so once you've lost the Windkessel effect, then in order to compensate, the heart has to contract harder. The systolic pressure has to go higher. And that's characteristic of people in their late 40s, 50s, and onward to have more systolic hypertension. And that's why they get it. So this is another reason. What I'm trying to tell you is the clock is ticking. You don't want to putz around on this and wait another 10 years because you're just going to trash whatever few fibers you have left of elasticity in your ascending thoracic aorta. It's like your second heart. Why would you want to destroy that? That would be stupid. Okay, you want to get your act together. The sooner the better. This is why. Okay, here's the arterial lining cells. They're called endothelial cells. They're spindle-shaped. They're orientated along the long axis in the direction of flow. They got little sensors that can sense the direction of flow. Normal blood flow is laminar. Laminar means that the red blood cells are in the center. It's sort of a parabolic velocity profile. Red blood cells in the center, white blood cells next to them, and then my thumb would be the plasma. Okay, the plasma is just a liquid with no cells in it. And that's how it should flow down the artery, okay? And the endothelial cells are designed to recognize that. Now, here's what happens when you have hypertension. When you have hypertension, it comes up at a higher pressure, and it smacks against the median divider in a bifurcation. So this would be like the common carotid artery coming up in the neck, and then it bifurcates. My thumb would be the internal carotid artery, goes up into the skull, feeds the brain. My fingers are the branches of the external carotid artery, go to the face. Okay. When the pressure is high, it bounces off and causes an excessive amount of turbulent flow. It'll also cause an excessive amount of retrograde flow. These are called eddy currents. Retrograde flow is eddy currents. When these are present in excess, they confuse the endothelial lining cells. An excessive amount of turbulent and retrograde flow is sensed as arterial injury. And the prothrombotic molecules on the cell surface of these endothelial lining cells will be shed into the blood. And instead, you'll have exposed adhesive molecules, things like VCAM, vascular cell adhesion molecule. And the red cells will stick to them and you'll form a clot. This is where you see clots all the time. I've seen many thousands of these things. This is let's say a CT angiogram, a catheter angiogram, an MRA, magnetic resonance angiogram. This is where you form the clot, opposite the median divider and the internal carotid artery. So you want to minimize this sort of thing. The way you do it is eating low-fat diets, which get your blood pressure under control, and low-sodium diets, okay? Another thing, too, that's good is to eat a decent amount of greens. You should be eating at least 5% of your calories from greens, some type of vegetables. Dr. Esselstyn recommends you eat even more of that, especially as you get older. He says that you make less and less endothelial nitric oxide as you get older, so you compensate by eating more greens. And especially you're going to have worsening endothelial function if you're eating a lousy diet for decades. All right, but anyways, the greens contain nitrates that come into your mouth as NO3, so nitrogen bound to 3 oxygens, all right? Then the back of your tongue has bacteria which convert the NO3 to NO2. This, by the way, is a nitric oxide oral pathway. You want to know this. This is valuable information here, okay? If you have a print screen button, hit your print screen button for this one, okay? Then the NO2 goes down to your stomach, and the stomach acid converts it to NO, nitric oxide. And that travels throughout your blood and has a systemic vasodilation effect to lower your blood pressure, to make you feel good. All right, but here's the pitfalls. You don't want to have fluoride in your toothpaste because that kills the bacteria on the back of your tongue. You don't want to use a fluoridated mouthwash. That also kills the bacteria on the back of your tongue, okay? Be careful with some antibiotics and do this as well. I actually brush my teeth just with the toothbrush. I don't even use toothpaste because the purpose of brushing your teeth is to get the biofilms off of there. The bacteria stick to your teeth with a biofilm. What causes cavity is the bacteria grab incoming sugar, run it through anaerobic glycolysis with the end product being lactic acid, and then the lactic acid is expelled onto the tooth and that burns a hole in the tooth. If you brush your teeth to get the biofilms off, then the bacteria don't stick to your teeth and you won't get a cavity. And you don't need all the toothpaste stuff. There's a whole bunch of toxic chemicals in toothpaste. But anyways, the point of this is eating greens is good for you. And be careful with, acid blockers in the stomach like PPIs, proton pump inhibitors. You drop acid production, you're going to lose this last conversion step, and that also can cause hypertension. So this is why brushing your teeth and taking these meds, antacids, can cause hypertension. All right. Now we're looking at the plasma membrane. Here's a potassium sodium ATP pump. And this is like an electrical battery in your cell. It maintains the ionic gradient, okay? And you want that to happen, all right? So it's pumping out 3 sodiums. It's taking in 2 potassiums because there's 3 to 2. There's a net outward flow of positive charge. So that's electrical current, charge separation across the plasma membrane like a capacitor. This is an electrical battery. That's how it works. And that established gradient enables the cell to couple the reentry of sodium to the pumping out of calcium, okay? Magnesium comes from the center of chlorophyll. So you eat the plants, you get the chlorophyll, okay? Plant cells have magnesium in the center, so that's good. They've got potassium all inside the cells, and then they've got fiber on the outer surface of the cells. So all the good stuff comes from plants. Magnesium, in one sense, is like a hero because it binds to the 2nd and 3rd phosphate on ATP. ATP is like a $20 bill in the cell for getting work done, okay? But you need magnesium to make it function correctly. Over 90% of Americans are magnesium deficient. Now I'm going to show you a few little tricks about remembering cell physiology and blood so you'll be able to understand food. Okay, the reason I'm going through this with the pictures and the story is this will help you to get this right because medical students screw this up all the time. I would guarantee if you ask, 20 of them, 19 out of 20 would not know what I'm about to tell you. But it's pretty simple when you see it how I describe it. So imagine that when God designed life on earth, he started in the sea, in the seawater, the salt water, okay? And then the salt water in the ocean rinses against the rocks. And when it rinses against the rocks, that's calcium carbonate, the limestone. It rinses calcium into the water. So you have to know that. Seawater is high in salt, sodium chloride. Key point is the sodium. And it's also high in calcium. You have to know that because the extracellular fluid around your cells is the same as seawater. And you have to know that sodium and calcium are high there. These are the concentrations. So here's extracellular. Very high sodium, very high calcium. Inside the cell, it's the opposite. Potassium is high inside the cell. Cytoplasm means inside the cell. Okay. Think of the sodium and potassium gradients as being about 10 to 1. The calcium gradient's about 10,000 to 1. But you need to know that potassium and sodium are, in a sense, opposites. You have to know that. Okay. And you can remember it easily that extracellular space is seawater. Therefore, it's going to be high in salt. Therefore, it's going to be high in sodium chloride. Therefore, it's going to be high in sodium. You have to know that. The seawater rinses against the rocks, and therefore calcium is high in seawater. You have to know that. Okay. Now, inside the cell, you're going to maintain a fixed amount of potassium and sodium. So if you eat a real high salt diet, you're going to gradually drift more sodium into the cell, and you're going to lose potassium. That's very bad. You do not want that. Okay. In order to create life on Earth, God had to pump out the beginning. You enclose a cell with a phospholipid bilayer. Okay. Then you have to pump out the sodium and the calcium. Otherwise, you wouldn't be able to put anything in there because you have to maintain osmotic neutrality. If you had more particles inside the cell than outside the cell, the water would flow in due to osmolarity, and it would just burst the cell open. So in order to have life on Earth, you have to first pump out the salt water, which means pump out the sodium, pump out the calcium. That's an important point. Okay, now I'm going to anthropomorphize things a little bit here because if you get what I'm saying, it'll always make sense to you, and you'll be able to move on up to much more complicated things if you want to. Think of calcium as being like Big Mama, okay? Big Mama comes home and she's the boss of the house. She's not reasonable. She's just demanding. I've been at work all day, and how come nobody put away the dishes? Get over here and put those dishes away. Hey, how come you didn't clean up the dog crap in the living room? Get over here, clean up the dog crap, okay? She knows everybody. She bosses everybody around. This painting is Piano Recital by Arturo Ricci, okay? So Mama comes in. She knows everybody. She tells all the kids what to do. She tells the other people, you do this, you do this, you do this, okay? Remember that calcium is the boss. No discussion. You do what she says, okay? Now here's the father. Dear old dad is potassium. Potassium is just a hard worker. He's a little bit kind of quiet. You know, he's working all day, paying the bills, make sure the family's okay. He doesn't talk so much. He's not always yapping at everybody like Mama, okay? So here's a train station painting by Edward Lamson. Here's, he gets the trains to run on time. He builds the roads. He's doing all the work, okay? Not a lot of talking, but a lot of work. And that's potassium. It runs that sodium-potassium membrane pump. And you got lots of potassium constantly working inside your cell. Just remember that, okay? Intracellular ion is potassium and magnesium. You have to know that. And what I meant about magnesium being the hero, here it is, like Charlton Heston and Ben-Hur hanging on to the wild horses. That's like magnesium hanging on to these phosphates that want to break apart. And it keeps them in place so all the cell reactions will run. Magnesium also is located in the center of the glutamate receptor in the brain, which is 90% of your brain neurotransmitters are glutamate, excitatory neurotransmitter, and it's really a calcium channel. And magnesium normally sits in there and blocks it, and that's exactly what you want. So magnesium makes sure it does not get activated unless it's supposed to. Given that over 90% of Americans are magnesium deficient because they don't eat enough plant foods, they're more predisposed to having this opened up too much and too much calcium flowing into the postsynaptic neuron, causing overexcitation. What does that mean? It means people are predisposed to more anxiety, more insomnia, more agitation. So magnesium, M for magnesium, also remember M for mellow. It mellows you out. When people eat more of a plant-based diet, they're more mellow, they're more calm, they've got better self-control. It's actually been a long time since I've gone through the book, but there was a lady who was a parole officer, and she noticed that improving the dietary quality dramatically decreased the recidivism rate on the parolees because they just calmed their behavior down. They did a lot of good things for them, okay? And this is one of the reasons here. Magnesium mellows people out. Eating plant foods mellows people out, okay? We don't have time to go into the details of it, but just remember M for magnesium, M for mellow. All right, now sodium is the angry poor. Sodium is accumulated outside the cell, and it's like, let us in. We want in. So sodium is banging on the walls, trying to break into the city. You want to know that. It's the angry poor, like Les Miserables with Victor Hugo. Okay, so how does that all work in real life? Sodium potassium pump over here maintains the gradient, the electrical battery, the power of the cell. And then that's coupled to pumping calcium out when you want to pump it out. When calcium comes in, that cell does whatever it's supposed to. If it's a pancreas beta cell, it'll release insulin. If it's a vascular smooth muscle cell, it'll contract. Cardiac muscle, it'll contract. Okay, if it's a neuron, it'll release its neurotransmitter. When you want to shut the cell off, you pump the calcium out by spinning the knockout exchanger, which is like a rotating door in a hotel. You let 3 sodium in and you pump a calcium out. That thing can pump out, thousands of calciums per second. And I'll just give you an example. Imagine I'm like a boxer training. I'm hitting a speed bag. Pop, 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 pop. When I punch the bag, I have to contract my triceps muscle. But to pull my fist back, I have to relax that muscle. So how can you contract and relax so fast? It's because this thing is so darn fast. It can pump out many thousands of calcium ions in 1 second. It's incredible. The complexity of the design of the cell is off the charts complex, okay? It's way beyond any computer or anything. The inventions of humans are puny compared to the inventions of God. Cell physiology is really complex, and it's beautiful. It's interesting. Okay, well, anyways, you got my point. In order to get these ion distributions correct, you have to eat plant foods. There's no medical, surgical BS or pill that can do this. If you don't eat your plant foods, whole plant foods, not processed food, intact plant foods, okay? Because they're going to have a lot of potassium inside the cells and magnesium inside the cells. The reason why you can't win with processed food is, let's say a corporation takes a processed food. They're going to put it in a machine. They're going to grind it out and flatten it. They're going to rinse it with water and a solvent. They're going to rinse away all the potassium. They're going to rinse away all the magnesium. And then they're going to take a salt shaker and put lots of salt on there. The reason they put the salt on there is it tastes good. And also they'll create a sodium-induced localized hyperosmolality so nothing can grow there like mold. All right, so what I'm trying to say is they destroy what is good about the food. They get rid of the potassium. They get rid of the magnesium. They get rid of the fiber. Those are the 3 things you need the most from your plant food, okay? So you don't want to eat processed food. I never eat anything that has more than 1 ingredient because they can add stuff to the second ingredient without telling you. But that's also why intact whole foods are always better, okay? You want something called a K factor. You want the ratio of potassium to sodium to be at least 5 to 1. And I really think it's preferable to be around 10 to 15 to 1 because that means you're getting adequate potassium. This is how our ancestors were meant to eat, okay? If you start going below 5, you're going to have blood pressure problems and cell function problems. Here's the K factor numbers. Typical fruit has anywhere from about 100 to 450 times more potassium than sodium. So that's a high K factor. Starches are next in blue, and they're anywhere from about 15 to about 60, okay? 60 times more potassium than sodium. Excellent foods, okay? Now, veggies are more in the ballpark of about 5 to 15 in their K factor. That's still decent, okay? Processed foods are bad. These processed foods, you start dropping around 1, less than 1, they're a disaster. They're going to predispose you to high blood pressure. People who eat processed food tend to be fat, sick, and have a lot of hypertension and diabetes, and they don't age well at all. Okay, here's food densities. Oil, pure oil is 9 calories per gram. Nuts and seeds are about 6 calories per gram. Meat, cheeses, sweets are about 4 calories per gram. Starches are about 1 calorie per gram, and veggies about 0.1 because they have the lowest caloric density. So the lower the caloric density you eat, the skinnier you're going to be. So if you want to lose weight, eat low caloric density. Eat lots of starches, eat lots of fruits, and eat lots of veggies, okay? Stay away from the meat. I recommend 100% veganism, no animal foods at all, okay? And I recommend avoiding high-fat plant foods too. No oil, zero nuts, 0 seeds, okay? When you eat a fiber food like a starch is basically a polymer or glucose wrapped in fiber. It's low caloric density, so it stretches your stomach. That's early satisfaction of hunger. And then it takes time to travel through your intestine, your small bowel, and have the glucose be absorbed. So it has a net effect of being like a slow-release energy pill. And that keeps you in the zone with a normal blood glucose the most prolonged amount of time, so you feel good. Okay, if you just eat simple sugars, you'll have a tendency to spike your blood glucose too rapidly. The pancreas overcompensates, drives it down. You end up with rebound hypoglycemia, and you don't feel so good. Okay, and then you'll grab some more simple sugar and end up with a roller coaster blood glucose curve. And we also previously talked about if you eat fat, then you get insulin resistance and your blood glucose gets chronically severely elevated as well. So the way you win the game is eating starches and fruits to satisfy your hunger, and starches are better than fruits. This is just showing you how much percent of fat in different foods. Basically, animal foods are terrible, tons of fat. Nuts, seeds, all that stuff, tons of fat. Soybeans, tons of fat. Same with flax. Okay, your starches are where you want to be, your starches and your fruits. Here's the Spartan vegan diet, which is sort of my version. The Esselstyn diet, the McDougall diet, and the Rogers Spartan vegan diet, they're all about the same thing, basically. Satisfy most of your hunger needs with starches, things like potatoes, sweet potatoes, rice, beans, oatmeal, quinoa. Then fruits, then some veggies. Okay. I recommend, Dr. McDougall would recommend 90% of calories from starch, 5% from fruits, 5% for veggies. But if you're pretty healthy and you're pretty careful, and especially if you exercise a good amount, you can eat a lot more fruits than that. I eat about 35% of my calories from fruits. The other stuff on the bottom is the fundamental basic stuff. Try to get along well as best you can with your friends, your family, your coworkers and stuff. Try to exercise some every day. Do aerobic exercise, do a little something for strength. I like walking upstairs. I like walking on treadmills. Get your sunshine. We're made to get sunshine, so try to get your sun when you can. Don't get sunburned, but get sunshine. Get your sleep. Study sleep. If you're having sleep problems, figure out how to sleep better. Religious people, any of the major religions, the people are all a lot healthier. Maybe because it reduces their stress. This is Sir Galahad the Pure fighting the 7 deadly sins. A bunch of maidens were imprisoned in a castle, the Castle of the Maidens, and he had to fight them, and he was motivated to fight against the 7 deadly sins, the Knights of Darkness. Okay, and what are the main pitfalls? The most dangerous thing I see that really kills a lot of patients is the Mediterranean diet, because anybody with a brain knows that paleo keto carnivore is for morons. So if you think paleo keto carnivore is good, then you're a moron, and you just need to study more. And it might be you might just have too low of an IQ to ever be able to fix things, but the person in the more of the middle level, slightly above average IQ range tends to be tricked by the Mediterranean diet. I call the Mediterranean diet the Antichrist diet because it promises salvation, but it doesn't deliver. I also call it the high-fat phony diet. And there's a lot of internet influencers who recommend what I would call the Mediterranean vegan diet or the high-fat phony diet. And the reason they do it is because they make money. I just do this as a hobby. It's kind of fun for me, and I recognize I could be the best doctor in the world. I think I already am. So that's why I went down this path. It's just a little hobby for me. But a lot of people are making money off the plant-based diet. And the way they make money is you have to sell stuff. And the way you sell stuff is mostly supplements and high-fat foods. There's a lot of money also selling caffeine, promoting coffee, promoting tea, promoting omega-3 supplements, promoting olive oil, okay? So what I'm trying to say is you're going to see a lot of people that seem credible, physicians from good universities who are quite articulate and seem knowledgeable. And I'm warning you, do not go down this path. I would recommend you try what I just said. Try low-fat vegan for 3 months. Check your baseline, body weight, blood pressure, total cholesterol, and whatever else you want to check. And then reassess where you're at in 3 months. Okay, that'll tell you what works. So you'll know for yourself from personal experience and go all the way with it, working with your doctor to titrate your medication dosages, if any. Because this is the biggest pitfall. And then all the other ones are kind of often related to it. Olive oil, fish, chicken, wine, beer, coffee, tea. All this stuff is bad. Nuts, seeds, avocado. It's all high fat. I don't like bottled water because it's full of microplastics, which have been found in people's brains at autopsy. I think it's much better to have a reverse osmosis filter at your house for the water and then just store it in glass. Second best choice would be stainless steel. And tap water's got estrogenics, fluoride, aluminum, all this bad stuff. I don't like it. A lot of these bottled waters are not too well filtered, and some of them are intrinsically high in fluoride from where they come from. Okay, then after Sir Galahad defeated the 7 deadly sins, he then went into the Castle of Maidens, and all these maidens were kind of excited to see him. They were kind of lonely. There's a funny scene about this if you go to Monty Python and the Holy Grail, the scene of Galahad in the Castle of Maidens. But anyways, he had to resist temptation, and he did. He remained Galahad the Pure. And here's what basically shows you the difference between these diets. The American diet, you're screwed. You're going to be fat, sick, and stupid by the time you're 60, if not sooner. With the East Asian diet like Japan, Korea, China, it's actually a pretty healthy diet. They used to eat about 90% of calories from white rice and then 5% from fruits and veggies. You know, that's a lot of white rice. I'd be bored sick from that, and it doesn't have a lot of fiber, but they still did pretty well. What got them in trouble was they were eating high dietary sodium, like 12 to 14 grams. Average Americans eating like about 4 or 5 grams a day, which is still way too much. But anyways, they were eating 12 to 14 grams a day. That caused high blood pressure. They also were smoking like chimneys. So that would end up giving them a lot of high blood pressure, intracranial atherosclerotic disease. Nowadays, though, they're doing much worse because they have allowed fast food into their country, processed food into their country, fried food, and more animal food. So they're starting to become just as fat and sick as Westerners. And the people of India, the thing that would get them in trouble is they especially ate way too much fried food. They'd eat some animal food, some dairy, yogurt and ghee, but it was especially the fried food making them sick. Low-fat vegan, you win all the way around, okay? You want low-fat, low sodium, 100% vegan, no oil, 100% organic, all whole foods, single ingredients, okay? No sweets, no caffeine, no nuts, no seeds, no avocados, okay? And I kind of call this God's way, like Genesis 1:29. Every plant on earth shall be food for you. The average American, though, I recommend staying away from the high-fat plants because, in a sense, you're not just trying to prevent disease. You're trying to detox. Most of you have previously eaten processed food, meat, fried food, oils, and all this other stuff. So you need to turn things around. And so you don't want to eat any processed food, any oils, okay? And like I'm trying to say, why I jokingly call this God's way, is because it's free. It's available to anybody, okay? These people in these third world illiterate countries, they've got clean coronaries. And then, the rich so-called science-based country like the USA and all these people, including the so-called educated ones, have plugged up coronaries, okay? And, when you go down the pathway of man eating all this processed food, the meat and the oils, you end up plugging up your arteries. You take all these drugs, drug. The drugs don't work so well. Then it's surgery, chop, 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 bye-bye money, premature death, okay? Man's way. It's expensive, it's painful, and it doesn't work very well. So it's wiser to go down this pathway. I don't take any pills. Okay, here's a graphic that a friend of mine drew on one of my slides. Basically, the typical chump thinks, oh, it's the doctor's job to save them. Save me, save me. And the doctor hands them one pill after another. And they just don't ever seem to do very well. And then you have the people who decide to be like Sir Galahad. They're going to take matters into their own hands. They're going to figure out what the Holy Grail is. So the Holy Grail is low-fat vegan diet, live like Adam and Eve. What are we made to do? Our ancestors from thousands of years ago, walk around outdoors all day in extended family groups, looking for plant foods. Our teeth are flat like a horse. Our jaw can go side to side to grand plants. We got a long intestinal tract, 22 feet, like a plant-eating animal. We make vitamin C. We don't make vitamin C because we get tons of it from our diet, okay? We have color vision to see when a fruit is ripe. Yes, we're omnivorous in the sense we have capacity to eat meat, but we're designed to primarily eat plant foods, okay? And so like my really smart internal medicine doctor friends, I say the reality is the patients don't know it, but they're the ones who have all the power. They're the ones who control what they eat. They're the ones who control whether or not they exercise, get their sleep, get their sunshine, have a strong sense of purpose in their life. If they're religious, that they avoid all this toxic stuff, caffeine, alcohol, tobacco, MJ, caffeine, MSG, processed food. It's their choice. So it's up to you whether you make yourself healthy or not. And it reminds me of you have to climb out of Plato's cave. I call it the pit of doom or Plato's cave of ignorance, where you listen to all the stories in the commercials and the newspapers. All that stuff is advertisement trying to get you to eat high-fat food or some other nonsense, caffeine or some other nonsense. Okay, think more like Adam and Eve. Adam and Eve did not have coffee and tea available to them, okay? Adam and Eve did not have alcohol available to them. They ate local plant foods, all right? And here is Jesus Christou leading the people out of the Valley of Tears, out of Plato's cave. Here's Adam and Eve. Try to live like them, but keep your indoor heating and plumbing. And like I said, McDougall would recommend 90% of calories from starch for somebody starting out in middle age or older years, and then 5% each from fruits and vegetables. But if you're more healthy and you're exercising a lot, you can eat a higher percentage of calories from fruits. Fruits are more available if you live somewhere warm, semi-tropical. A lot of people live in cold areas. They're not so available, and they spray a lot of stuff on them sometimes too, so they don't store as well, and they're expensive. But anyways, if you learn from this and you give it a try, I think you'll be like Sir Galahad. You'll have a chance to achieve the Holy Grail, improve your health, and you'll save a lot of money. You don't have to take any pills. and you'll be grateful for that, and everything in your body will work better. Everything in the body works better with good blood flow, which comes from low fat, low sodium diets, and also having all those vasodilators which come from the plants. So good luck in your quest to achieve the holy grail of healing, low-fat vegan diet, and I wish you well, and that's the end of this talk.
Thank you very much, Dr. Rogers. That's a lot to take in, but I love the way we're all lawyers, so we like the evidence that supports the conclusion, and you get right into it. We had a few questions. Someone asked, are the visual aids downloadable? And I don't know if they are, but your books have a lot of those visual aids in them. So if I can plug your books, it's probably a good way to get them. Gary said he concurred. Read Dr. Ellison's book, Prevention and Reverse Heart Disease, and Changed My Life Forever. And we had another question. Where is the best source to keep up to date on this great information? Do you recommend any books, websites, or podcasts?
Yeah, like I do think it's a good idea to read Dr. Esselstyn first, because Esselstyn will tell you what you need to know to get yourself into the game. And then where I kind of come into the picture is I go into a lot more nuance. I'm explaining all kinds of things about why you need to filter your water, what are secondary causes of blood clotting, to try to optimize things, okay? So you can learn about my work from reading my books, from going to my YouTube channel, Peter Rogers, MD. Dr. John McDougall has excellent lectures on coronary artery disease and diabetes as well. And so I would recommend you keep on watching these videos and learning so that you become more knowledgeable. Your decisions become well-informed. You're not just doing things on an impulse or a whim or trust. Once you study a lot of this stuff, like I won't eat the processed food because to me it's like poison. Why would I want to do anything that's harmful to my health? So I think it's a good idea. You'll also sustain your momentum better if you have ongoing education. You could simply, like I said, read when you're on a treadmill, read when you're in your bathroom, listen to an audiobook in your car, when you're eating dinner, watch a YouTube video, and just keep yourself getting informed on it. But the biggest way people screw up is they start falling into the path of what I call the high-fat phonies, the Mediterranean diet, which is really a high-fat diet. If you look at the calories, I've done the numbers on it. They're eating about 35 to 40% fat. That's a disaster. Whereas the Rogers Spartan vegan diet, Esselstyn diet, all those things are less than 10% fat and typically around 5%, 5 to 10% of calories from fat. And that's what you want to prevent atherosclerosis. There was a guy by the name of David Blankenhorn. He did an extensive study of atherosclerosis, and whatever type of fat the people ate, they all were atherogenic. It didn't matter if it was omega-6s, sat fat. They're all atherogenic. And people think omega-3s are so great. Yeah, right. They increase the risk of atrial fibrillation. They increase the risk of prostate cancer. They're fat. Okay, they have a high risk of being lipid peroxidized, and you can get all these secondary reactions like the hydroxynonenal type series of reactions. You're not going to win with fat. Okay, fat is big money, so you're always going to hear fat promoted all over the place, but you're not going to win with it. And also things like coffee. You're going to hear coffee as a wonder substance, but in reality, coffee is terrible for your health. It raises your blood pressure. It raises your blood lipids. It raises your blood glucose, so it predisposes you to diabetes and hypertension. I also told you it predisposes you to cognitive decline because it simultaneously increases the metabolic rate of your neurons while dropping the blood flow. It's a vasoconstrictor. It drops cerebral blood flow about 20%. The reason you don't hear these things in the mainstream is that there's corporations worth billions of dollars promoting these food products, okay? They have no incentive to tell you the truth, So you're not going to find the truth about nutrition in the mainstream. The mainstream is there to make money. It's not there to, tell you the nuance like that.
Last question, because we're 15 minutes over, but your thoughts on multivitamins? I'm assuming they're not necessary.
I think they're kind of a joke, because what I mean by that is, think about it this way. People, here's what's going on in the person's brain. A plus B plus C together makes E for excellent, okay? But in reality, very often, that vitamin they're taking, they're overloading their body with one of those three initial substrates. And then what the body does is it runs a side reaction off of there, which is damaging. The only time a person should take any type of vitamin, in my opinion, is if they have a true deficiency of it, okay? And most people don't. Most people, what they're deficient in is magnesium and potassium and fiber because they don't eat plant foods, okay? If you eat a well-rounded plant-based diet, even if you eat kind of a lousy plant-based diet, but it's still whole, intact plant foods, you probably don't need to take anything. What you might eventually end up taking is vitamin B12, but vitamin B12 is actually a surprisingly controversial thing. It's much more complex than people think it is. We don't really have time to go into all the details of it, but I can just tell you, I guarantee it's way more complex than you think it is. And whether or not you need to take it at all is quite a matter of debate. I used to take it, but I don't take it anymore. I'll leave it at that.
All right. Like I said, we're 20 minutes over. I got to let you go, but everybody, his YouTube channel is Peter Rogers, MD. He's got a lot of videos on there that explain things very simply to you. Thank you, Dr. Rogers. Appreciate your time.
Thanks.